So we'll start to discuss the questions which is asked in the DHA Ayurveda exam for the Prometric. Okay, so the recent questions we'll discuss. So the first one is 67-year-old patient. He came with a mild prostate enlargement, increased frequency of micturition. What is the best diagnosis? So the most common condition which is causing in a old age male patient is BPH, benign prostatic hyperplasia, which means enlargement of the prostate gland. So because of this enlargement, it will compress the urethra, and because of that you will be getting lower urinary tract symptoms. Okay, so like difficulty in starting the urination, weak urine stream, and after the urination there will be dribbling of urine. You can see straining, inability to complete the empty of the bladder. So such type of symptoms you can see. And urgency, nocturia, frequency. Okay, night time also there will be increased urination you can see. So these are the main symptoms of the BPH because of the enlargement of the prostate gland. This is usually seen in the old age male patient. Next question is regarding orthostatic hypotension, which means if a patient is standing in a supine position and then they will be changing into from the supine position the patient will be changing into standing position. So that time there will be a drop of blood pressure is happening. That is called as orthostatic hypotension. Usually you can find this symptom in pheochromocytoma, diabetic autonomic neuropathy, Wilson's disease, and multiple system atrophy. These are the common conditions where you can find orthostatic hypotension. Next question was regarding clubbing of the toe. It is not digit, okay, it is not fingers. So the clubbing of toe you can find in the PDA, patent ductus arteriosus, and then infected abdominal aortic aneurysm. These are the two main conditions where you can find clubbing of toe. Okay, clubbing of it is not fingers, it is toe. It was the question. So it is usually seen in patent ductus arteriosus and infected abdominal aortic aneurysm. Next question was regarding menopause. So during the menopause, what are the hormones we have to check? So usually we have to check is the estrogen, FSH and LH hormone. During menopause, there will be less estrogen secretion, and to compensate the less estrogen secretion, there will be increased secretion of FSH and LH hormone will be there. So in the menopause time, you will be getting less estrogen, increased secretion of FSH and LH hormone you can see. Okay, and if you wanted to identify if a ovulation is happening or not, then during the 21st day, you have to check the plasma progesterone. Okay, if you wanted to identify ovulation has happened in a lady, for identifying that on the 21st day, check the plasma progesterone level. Next question is vitamin A seen in. Okay, so vitamin A, it is a fat soluble vitamin. For the complete absorption of vitamin A, we require bile salt and dietary lipid. These are the two important ingredients for the absorption of the vitamin A. Vitamin A usually we can see in the carotene rich food, that is orange, yellow, green vegetables, liver and milk. In these food items you can get vitamin A, and it is stored in the liver. So the main function of the vitamin A to maintain the health of the epithelial cells, and it will inactivate the free radicals, and it helps in the formation of the light sensitive pigments. Okay, in the retina. If the light sensitive pigments are forming, then only you can see the vision in night time. Okay, so the light sensitive pigments are forming with the help of the vitamin A. At the same time, they are helps in the formation or helps in the regulation of the osteoblast and osteoclast. Through that way, the bone growth also will be maintained. Okay, so these are the main functions of the vitamin A. If deficiency of that, because of that it will result in the atrophy or keratinization of epithelium. So because of that you will be getting dry skin and dry hair. Okay, so vitamin A deficiency causes dry skin and dry hair. Then because of the inactivation of the free radicals, it will not happen properly, so the patients can get increased incidence of infectious condition, ear infection, sinus infection, respiratory infection, urinary tract infection, digestive system infection. Because of this infectious related condition they can get because of the deficiency of vitamin A, and the patient will not be getting weight, also weight gain, drying of cornea, skin sore. These all conditions can happen because of the vitamin A deficiency. And vitamin A is not there, because of that light sensitive pigments will not be forming, so it result in the night blindness. Then osteoblast activity will not be happening properly, so it result in the slow and faulty development of bones and teeth. So these are the deficiency disorders due to vitamin A. Dry skin, dry hair, drying of cornea, skin sore, infectious condition, night blindness, and slow and faulty development of bones and teeth. That is also important. So these are the deficiency disorders due to vitamin A. So vitamin A related condition, anything have they can ask. So these are the main important things related with the vitamin A. Rest we can discuss in the next part.